have a conversation today about hospital websites and access and messaging to support families as care partners. We have been so pleased over the last few years to work with the New York State Health Foundation and the New York State Public Interest Group to further this work, in particularly New York State, but we know that we have many friends and colleagues across North America that have been very engaged in this campaign to change the concept of families as visitors to true care partners. Next slide, please. I'm Bev Johnson. I'm president and CEO of the Institute for Patient and Family Centered Care, and am thrilled to work with Deborah Dokken, who is a coordinator for patient and family partnerships with IPFCC. She brings her family perspective to all of our work, and she has been the key lead for the Better Together campaign since it started in 2014. Next slide, please. We certainly have been delighted to work with the Northwell Health System in New York State in this endeavor, and have such great respect for Aggie Barden, who serves as Vice President for the Office of Patient and Customer Experience at Northwell, and truly believes in the partnerships with patients and families in their own care, but also in improvement and changing organizational culture. Also on the Northwell Health team was Mallory Toomey, who we've been so pleased to have a key part of the overall project, and really a key facilitator in aspects of it, really the journey around Better Together at Northwell. And she serves as a manager for the patient experience communication and events team. Next slide, please. So in our time together, we're going to have a little context about the Better Together campaign, what it was trying to achieve and various aspects of it. Then Northwell is going to describe how they participated in the Better Together learning community for hospitals in New York. And I think you will get just wonderful inspiration for the way they went about the work and what they're trying to achieve. And then we want to plan time for you all to ask questions, to share ideas about what you are doing in your organizations. So I think now the next slide, please. And I'm delighted to turn this over to Deborah Dokken, who will talk about the campaign.
Thanks so much, Bev. We wanted to take just a few minutes before we hear about the exciting work at Northwell. We wanted to give you quick background about IPFCC's campaign, Better Together, partnering with families, because what Northwell will be talking about is in the context of that program. Better Together is a national and international program, and its goal, as Bev mentioned in the beginning, is to change the concept of families as visitors to families as care partners. And if families are regarded as care partners, then their participation and presence is welcomed and supported 24/7. And the important role they play in the quality, experience, safety, and outcomes for patients is acknowledged. There is a growing body of data about the positive impact of family presence and participation. It's not something we have time to share today, but we certainly can if anyone wants to. Next slide, please. We always like to share this slide showing clinician support for family presence and participation. And the quote comes from Sam Brown, who is an intensivist in Utah, who founded something called the Center for Humanizing Critical Care. And quite frankly, Sam Brown doesn't mince words in his quote that you see. And really, what he's saying is, in a time when we're talking about patient and family centered care and the authentic engagement of patients and families, physical barriers like visiting hours don't fit and don't make sense. And really, what those visiting hours are clinician centered ways of operating, not patient and family centered ways. Next slide, please. So just a bit about the history of Better Together. It was launched in June 2014 in the US. And when we launched it, we had developed an extensive toolkit of resources that are available on the IPFCC website for anyone to download for free. And those resources are anything from profiles of hospitals that have done this work, like Northwell, to sample policies, to templates for websites, and Bev will mention that. Better Together has been extended and adapted across Canada through our partner organization, the Canadian Foundation for Healthcare Improvement. And I always like to say they even translated some of the materials in French, if any of you need them in that language. And then in New York, with generous support from two different foundations, we were able to focus Better Together first in New York City and then more broadly across the state. The New York City project ended in June 2017. And I do want to mention that that project in New York City involved all of the public hospitals in New York City. The current project in New York State, which Northwell was a big part of, was just completed this fall. And for each of those two projects in New York, we collaborated with the New York Public Interest Research Group, and they published their report, special editions of their report, Sick, Scared, and Separated from Loved Ones. The first one in January of 2018. The current one, they are actually doing the press release and conference today for the new report, and we'll be able to send you the link to that report later. Next slide, please. So the project that Northwell was part of was the learning community for New York State hospitals. In addition to the Public Interest Research Group, an organization called New Yorkers for Patient and Family Empowerment collaborated on the project. Next slide, please. And just some key aspects of that project. We worked with two cohorts or groups of acute care hospitals, 26 in total, and Northwell was its own cohort. The hospitals that participated received a series of coaching calls with Bev and myself during the period of time that you see indicated there. And we were able to measure change and improvement in policy and practice in a couple of ways, but the one that we've talked about is the special edition of Sick, Scared, and Separated from Loved Ones. Next slide, please. So these are the two reports published by the Public Interest Research Group. The prior one in January of 2018, and the current one that, as I said, is being released today, and we'll be able to share the link with you later. Also, 1 week from today, we'll be doing another webinar with staff from the Public Interest Research Group talking about some of the findings and recommendations of the report. And so now I'm going to turn it back to Bev.
Great. And we noticed that on the call today, we have a number of people from state hospital associations, and we would be eager to talk with you about replicating this work from what we've done in New York over the years to other states. One of the things that we discovered in the Better Together campaign was the importance of websites. And it's become a pet peeve of mine that I feel like in the last couple of years, websites for hospitals and health systems seem to be taking a step backwards. And what I mean by that is the website of your organization, whether it's an individual hospital or a large health system, is really in many ways the welcome mat to the organization. It's the public face of the organization. It's not the only place where people get information about a hospital stay or a clinic visit or the emergency department or even applying to work at the hospital, but it is a key information source. And we feel very strongly that it should reflect your organization's commitment to a philosophy of care, what your core values are, and so that they would know the type of organization that they are approaching for either care for themselves and their family members, or to think about working at that organization. And we really believe that the website should convey a commitment to patient and family-centered practice. We're backed up in that belief by people like Lucian Leape, the father of patient safety, saying that an organization should be explicit about that commitment as part of their safety culture. So I urge you to go and look at your websites with new glasses on and to see whether it is easy to find useful information for patients and families. Does it really convey that they are essential members of the care team? Is it really consistent with the core concepts of patient and family-centered care, of respect and dignity, information sharing, participation, and collaboration? And while it is a great resource for patients and families, it is also, I imagine that everyone who applies to work at your hospital probably looks at the website before they submit an application or to come and have an interview. And you want to attract people with a commitment and an attitude that is consistent with patient and family-centered care. So just another reason that your website should be examined carefully and thoughtfully, and with patient and family advisors and people who understand from a clinical perspective, patient and family-centered practice. It should not be left alone to communications and marketing. I think that it's an unfair burden to place on them. It should be a collaborative endeavor. Next slide, please. So we evolved in our understanding and recognized the need that we needed to give very explicit guidance and to really build on what exemplar hospitals and health systems are doing with their websites to try to make that more accessible to people. So I hope all of you on the call today will use this information to go back and review your websites and put together an interdisciplinary team with patient and family advisors to work on the website. So one of the first things to look at is there a specific section for patients and families or care partners? You want to look at that top navigation bar and see most websites will say patients and visitors. So they already automatically labeled everyone besides patients as, quote, visitors. You want to make it very easy for a family or care partners to find useful information. I think we're all moving very fast in today's world. And if you have to do a lot of clicks and dig around, it should be very intuitive. And this is where patient and family advisors could really help you. I think you also ought to be reinforcing, because we have conditioned the public not to be active members of their own healthcare teams and really engaged in care planning and decision making. So this is another way you can influence the general public and anyone coming to use your hospital or health system. And it really helps to have simple guidance for patient safety so that they are prepared to be on their safety team, whether they're a patient or a family member or care partner. You want to convey clearly that care partners and families are welcome. They don't have to stay 24 hours a day, but it is an option they can plan best for themselves and their loved one. Most websites now that would fall into the exemplar category are making a distinction between visitors and families and care partners. Visitors are important to patients, but they have a different role. They're not going to be as engaged in learning medications and therapy and involved in developing the care plan. So you want to make a distinction. And we, of course, the data is quite clear that you should, leave the decision about children and siblings participation to families. And what they think would be best for their family. Next slide, please. For part of this Better Together learning community, we developed a template to help the hospitals in both cohorts think about their website and think about how they organize it and try to make it easier for the people in the communications and marketing. And I'm hoping that this would be something you could take and look at. There's a section clearly, if you look at the top navigation bar, it says patients and families. And then you look at the navigation bar on the left side of the slide, and there are chapters here that have useful information for patients and families. And it's all in one place. So if you click on patient and families, you've got a lot of other places you could go and come back to. So you can see, we talk about how to use the patient portal, safety and quality, peer support, learning more about patient and family-centered care. And here's another pet peeve I have. Often on websites, I see billing at the very top as the first thing they need to see. And again, I think it ought to be there, but it doesn't need to be at the very top of the list. So I think you can find your way easily on that. Next slide, please. And this is an example of Seattle Children's that for years has had quite a good website, being very clear about partnering with the team, even when they describe who all the members are on the child's healthcare team, which is just one click away from this homepage here for patients and families. It reinforces that you as a parent are an important part of safety efforts and of your child's healthcare team. So that's just an example, and I look forward to learning about the exemplar websites you all develop. Next slide, please. And I am thrilled now to turn it over to Aggie Barden, who's going to share some of the Northwell Health amazing journey.
Hi, good afternoon, everyone. And thank you, Bev and Deborah, for the lovely introduction and your continued valued partnership with our teams. So once again, my name is Aggie Barden, and I'm the Vice President of the Office of Patient Customer Experience at Northwell Health. And I am truly honored to be sharing our Better Together journey with all of you today. So let's start by reviewing who actually we are here at Northwell Health. And Northwell Health is a large integrated health system in New York, stretching across Long Island through New York City and Staten Island and up through Westchester County. We have currently over 23 hospitals, 750 medical practices, a medical school, an advanced nursing and physician assistant school, a research institute, and a large community health imprint. We are New York State's largest private employer, caring for approximately 10.8 million New Yorkers per year. Northwell is also a dynamic, innovative organization strategically focused on clinical care, education, research, population and community health, as well as venture opportunities. In terms of our greatest assets, however, it's our people. We employ over 69,000 employees, in which approximately 4,000 are physicians.
Next slide, please.
Okay. So at Northwell Health, we have 3 promises. Our brand is our promise to our consumers. Our employee promise is simply our promise to one another. And our culture of care is our promise to our patients and families.
If we click again.
Our mission is to provide world-class service and patient-centered care while living our value, truly compassionate.
Click again.
And by doing so, we make every moment matter for our patients and families and one another. And every moment matters is our patient experience definition here at Northwell Health.
We can click again to the next slide.
So this next slide really goes through our whole strategy and structure. So our mission as the Office of Patient Customer Experience is to inspire, challenge, and lead Northwell Health to design and deliver experiences our patients and families desire. As I just mentioned, the system definition for patient experience at Northwell Health is every moment matters, meaning that every role, every person, and every moment is a moment of truth impacting the overall experience for our patients and their families. Our overarching system goal is to achieve the 90th percentile in patient experience for Northwell Health by 2020, and thanks to our amazing teams and incredible partnerships, we've been able to successfully stay on track on meeting this upcoming goal.
Next slide, please.
So here's a quick view of our patient experience strategy. The strategy focus is built around 4 main pillars. The first one is culture. And in culture, we look at a focus on the expressed and unexpressed needs of others. In care delivery, it's processes for an enhanced human-centered experience. And hospitality is creating that warm, welcoming, and healing-focused environment. And of course, you'll see accountability is woven through all of them, because this is important that we have an accountability focus through culture, care delivery, and hospitality.
Next slide, please.
Right. So, 5 years ago, our team reorganized and formalized a system-wide patient and family partnership council structure throughout our organization. Representatives on the council included a Northwell patient experience leader and a patient and family partner, co-chairs in teams of 2. I always say like Noah's Ark, from councils existing in nearly all the hospitals as well as service lines. So it was a true model of partnership. Our nationally recognized Patient and Family Partnership Council is based on listening to the voice of patients and families and promoting collaboration, with the ultimate goal of driving change across varied aspects and experiences of the healthcare delivery. It's grounded in the core principles of collaboration, advocacy, respect, and effective communication. And our office oversees the establishment and sustainment of the councils for the system by providing an extensive toolkit of resources for hospitals and service lines, which include best practice sharing, mentoring, networking opportunities, and on-the-road exposure to various locations and focus areas throughout our organization. So in the photos on this slide, you'll see our system council members, a photo of Bev and our team when she came to visit, and our teams in front of a bus we arranged to take all of our patient partners to our Northern Westchester site to participate in and learn about their local council structure. I always say it's inspiring to work in partnership with our patients and families as they remind us what is most important, and together we make real impactful changes for our organization.
Next slide, please.
So this brings us to Better Together. In September of 2018, after discussions with Bev and Deb, a partnership opportunity arose with the IPFCC with us. While we already had a robust council structure within the organization, we instantly felt this partnership would provide additional leverage and scope to take our council goals to the next level. We were so grateful to be accepted into this learning cohort based on expansive footprint in New York State. It was at this time that the Better Together learning community for hospitals in New York State was initiated as a fundamental next step in our progressive journey to enhance system-wide family presence and participation. A first step in our partnership included pre-organizational self-assessment survey, which was completed by 15 of our hospitals, which are listed above. Results from this self-assessment tool identified opportunities in 3 distinct areas. The first was on policy and staff education. The second was on position descriptions and performance management. And the third on website and signage.
Next slide, please.
So we were all in. In a 10-month period from October 2018 through June 2019, our 15 hospitals were able to implement significant patient and family-centered improvements. This happened through the establishment of multifaceted shared work teams that partnered with the common goal of supporting family presence. Northwell's shared work team structure, a best practice structure that we commonly use throughout our organization, especially in the operationalization of patient experience initiatives, allowed teams to meet individually on specific tasks led by a dedicated staff member from our OPCE team, which we call the Office of Patient and Customer Experience, to ensure that we're meeting progress and supporting and holding each other accountable. A total of 6 monthly coaching calls or report-out meetings were attended by participating teams where feedback and pertinent recommendations were shared by the IPFCC and were discussed in order to maintain momentum and results.
Next slide, please.
So as a result of our main takeaway, the theme from this experience can be summarized in one key word, and that's synergy. I'm going to say it again, synergy. Okay. Success does not occur in silos. We've been able to see true engaged and lasting change through our ability to engage leadership teams and mobilize instrumental partnerships across our organization, such as our patients and families, marketing communications, facility operations, policy, competency, and HR, to name a few. Ultimately, it's about finding the yes and meeting patients and families where they are and leveraging the power of partnership.
Next slide, please.
So before we step into the work we did around our websites, we wanted to also briefly walk you through some of the key changes we made in our other shared work teams. So we'll start with our policy and staff education. The policy staff education shared work team focused on appraising and updating existing policies to ensure alignment with key patient and family-centered concepts and Better Together principles. By establishing representation on the Northwell System-Wide Policy and Procedure Committee, OPCE enabled patients and families to have a voice at the decision-making table. One overarching policy entitled Visitation Guidelines was reviewed and updated to reflect Northwell's mission of patient and family-centered care, retiring the reference of families as visitors and incorporating language of inclusion and partnership. The policy was vetted through a multi-layer process of review and stakeholder feedback and was ultimately approved under a new title called Visitation, Presence and Participation of Families, Support System Designees, and Visitors in Care.
Next slide, please.
Our second shared work team was the Position Description Performance Management shared work team, and it focused its efforts on incorporating patient and family-centered concepts and language into position descriptions and the performance appraisal process. The shared work team was successful in advising the leaders overseeing this job architecture initiative on the importance of including language of patient and family centeredness and partnership into subsequent documents. Collaboration with HR, talent management, and organizational development, there was opportunity to refresh rating scales to include the behavioral demonstration of patient and family-centered care, collaboration, respect, and partnership with family members. This multi-pronged approach truly reflected our organization's ability to mobilize a cultural priority across a very large, dynamic healthcare organization. And now I'll hand it over to my colleague, Mallory Toomey, to speak about our efforts around the website signage shared work team.
Next slide, please. Thank you so much, Aggie, and good afternoon, everyone. Once again, my name is Mallory Toomey, and I'm the Manager for Patient Experience, Communication, and Events within our Office of Patient and Customer Experience. I was actively involved as the lead for our team's efforts around the website and signage component of Better Together, and I'm so happy to be speaking with all of you today. So as mentioned earlier, and especially through this process, we learned the true importance of our websites and the impact they have as really a first impression tool for patients and families looking for information to best prepare for their care experience. So this slide provides a high-level view of the work achieved by our teams in a very short period of time. Our website and signage shared work team focus not only on redesigning our hospital websites, but also enhancing digital signage across our organization, along with performing a baseline assessment of physical signage across our facilities in key areas of patient and family impact. Some of those areas include our emergency departments, main lobbies, cafeterias, surgical waiting areas, and ICUs. As we know, this can also greatly impact a first impression. So in terms of our websites, while we were, I think, in pretty good shape and we meant well, additional feedback from the IPFCC identified even further opportunities for us to include more patient and family-centered, care partner-infused language, and also streamline our click levels. And what that means is really just the order in which information is viewed for easier access for patients and families. So with our expansive footprint, we knew that changing our websites would be a robust undertaking, to say the least. So when we were thinking about a first step, where were we really going to start, we knew it had to be grounded in partnership and sustainment. So we began with establishing a solid partnership with our internal web team. We needed to fully understand the website process. This was new to us. So we needed to know all the opportunities as well as potential barriers, for example, competing priorities throughout the organization, system go-live scheduling, branding language, and more. So respectful of the web team's bandwidth, we included the director of web services in the shared work team to make sure the team was fully engaged in the process. We then worked to create carefully crafted, streamlined content for the websites, utilizing IPFCC's best practice standards as a framework and guide, and we really have to say the template provided was a huge help in getting us started. Next, in order to make certain our changes would actually last, we established a multidisciplinary website shared governance team to ensure the inclusiveness of key stakeholders to review and make necessary recommendations. The team included patient and family partners, patient experience culture leaders, team members from quality, compliance, human resources, policy, chief nursing officer, medical director, and representation from the Institute for Nursing. This engaged group really allowed us to obtain the buy-in that we needed to effectively go live with our changes. So after careful review and consideration from Northwell's family partners and teams, all our participating hospital websites were enhanced as of June 2019 to include prominent one-click access from our home pages to pertinent patient and family resources. making the distinction between families and care partners, something we are really extremely proud of. Next slide, please. So to show you what this looks like, we'll try to kind of click through and give you more of a snapshot. So we included patients, families, and visitors on the main webpage tab. So you'll see that highlighted there. Then if we click again, on the next click, we raised your care partner's information as the very first bullet during your stay. So you'll see that highlighted there. That was not the first bullet before, and we wanted to make sure that it was much more prominent. And then if we click again, the next includes all our improved revised content to include information for and about patients and families. And if we click again, those are, just click one, yeah, we see content highlights in that page are patients and family information, choosing your care partner, tips for care partners, and spiritual support, which actually was a recommendation from our very own shared work team. So we were able to learn not only from the IPFCC based on their resources, but we were also to personalize for our own needs, listening to the voice of what was important to our patients and families. Next slide. So since the inception of Better Together, our organization has been able to infuse a more patient and family-centered emphasis into our overall message of every role, every person, and every moment matters. And the best takeaway for us was really seeing this overwhelming sense of counsel rejuvenation, as well as a renewed focus and purpose to the work. So here are just some takeaways we wanted to highlight from our Better Together shared work team members when they were asked about the overall impact this collaboration had on them, and just some call outs that really stood out for us, and I'm sure they would stand out for you as well. I can no longer look through our lens, but through the lens of our patients and families. I felt heard and appreciated. There was synergy, as Aggie mentioned before, awareness, partnership, and this really had a profound impact on my life. And really the list goes on and on. Next slide, please. So throughout the process of this impactful work, Northwell's patient and family partners were also involved as key stakeholders and contributors, and this was really foundational to our process. So some specific highlights of their feedback included some comments such as, "I'm so happy to help other families in crisis so they don't have to be alone like I was. And I feel how important the patient and family's voice is. It's truly a partnership between patients, families, and staff." So Northwell Health's ability, our ability as an organization to meet patients and families where they are, truly listen, and consistently respond to what they need has really made a difference in the quality, experience, and safety of the care we deliver here at Northwell. Next slide, please. So we would like to really thank you, and we want to open it up with any questions you might have for our team.
And just as you're getting ready to ask us questions, we again want to thank you, both Bev and Deb, for your support, your guidance, the tools you shared with us, the conversations you had, the focus that you set us on, the path that you set us on. We truly appreciate the amazing partnership. And I just want to have a personal shout out to Mallory and Nicole Giamarinaro, who've been amazing partners on this work, along with our patient partners from across the organization and our patient experience leaders who sponsored the councils at their site. It was truly a team effort, and everyone's voice was important and heard. And I think we're so grateful that we had this opportunity.
All right, so we have one person, and not entirely, Maureen, I believe. I did unmute you, so see if you can speak. Maureen, I don't seem to hear you. It might be easier just to either type it into our chat or into. So let's see. We have Eileen who asks, do you have analytics or metrics/KPIs to measure your success of focusing on patients, families, and visitors on your website?
Yeah, hi. Thank you so much for that question. So we don't really have any specific areas of measurement in terms of, KPIs, but we have been able to see significant traction in terms of the feedback that we've been getting from our teams, that the information is a lot clearer, and that we're able to, really feel that our patient partners have felt that the information is a lot easier to communicate in terms of what they're looking for from visiting our websites.
What I will also add is, in the Office of Patient and Customer Experience, we have defined metrics through star ratings and also specific questions through our Press Ganey vendor. But I'll share with you that in terms of physician communication, nursing communication, response, these are all star rating metrics that have significantly improved for us. We're doing other initiatives besides this work. We're doing a lot of things, but our focus is always the voice of the patient and family. And so through all of our other initiatives, we bring that important role to it, and we let people know that everything is connected, and we're here really to take care and serve patients and families. So we bring all of this work into our patient experience initiatives and tie it all together. It's very integrated.
All right. And then we have another question. How did you get the marketing, how easy was it to get the marketing team on board?
Yeah, honestly, we were really lucky. Our marketing team was very willing to partner with us. As we mentioned, we have a culture leader framework within our organization. We have Bill McGlone, who is the director of our web team, who is one of our culture leaders. And our culture leaders are kind of take the lead on patient experience throughout our organization, throughout our sites and facilities. I think a big thing for us is power with, we don't come with a heavy hand over. We really work with our team members. We kind of get them engaged, get them excited about the work. And they really knew from the jump that this was something that was a priority for us. So we, just really partnered right away. And I think they also saw that we were flexible with their bandwidth. We didn't come with our expectations. We really tried to make it as collaborative as possible and as flexible as possible. So it truly was a team effort, and they were just as excited at seeing the work come to fruition as we were.
And I just want to highlight, Mallory mentioned this, but I just want to focus the point in terms of our patient experience leaders in our organization. We have 63 culture leaders across our organization. They are not all in patient-facing areas. We really thought it was important to put culture leaders in areas such as marketing, HR, finance, procurement, et cetera, because we felt like everyone here in the organization has to be tied to the patient experience, whether you're directly front-facing staff or you're in a different type of office setting. Every role, every person, every moment matters to the experience.
All right, and then we also have, how did you get the frontline staff engaged to wanting to partner with families?
Yeah, so I'll say for us in this group, we started really with our site leaders and our patient partners. But what we've also done is we have created a curriculum in our organization called the Culture of Care. And in that curriculum, we all talk about why we got into healthcare, what keeps us here, and we go through specific roles and the importance of how they relate to patients and families. So for those in the frontline facing roles, we talk about part of your role in working in our organization is to really build those relationships with your patients and families. And we strengthen everything, and we talk about our patient partnership councils, and we share with them what they're working on and the outcomes that that partnership has really impacted.
Awesome. So we have, I think, 4 more questions so far. Does Northwell Hospital maintain a page for its Family Advisory Council? And if so, what is the content there apart from how you have improved the hospital's website?
I'm sorry, can you repeat that question one more time?
Oh, sorry. Does Northwell Hospital maintain a page for its Family Advisory Council? And if so, what is the content there, apart from how you have improved the hospital's website?
Yeah, so we have a patient-family partnership page on our general site. So we have on our system site, we have a section for the Office of Patient and Customer Experience, and as we leave that system council, we then have information about our patient-family partnerships. We have the names of some of our team members that participate in it. So we kind of house that information there. I think our individual hospitals also have some information as well based on their recruitment efforts.
Okay, awesome, thank you. And how do you assure that your participation is diverse enough to hear the voice of all? We are struggling to get some of the minority groups involved to get their voices heard.
Right. So that really strikes a chord with us. We live, our organization is really located in probably one of the most diverse areas, especially in Queens County, which is probably one of the most diverse areas in the country. So we do have some diversity. That's an area that we want to continue to grow in going forward. And we're doing a lot of work with population health and social responsibility and different things like that, that we're really looking at expanding. So this work is never done. This is always about sustainability, and part of our work going forward is to really look at our council representation and to make sure it's more reflective of the patients and families we serve. We're doing that also with the teams, the team members we hire. That's also important to us to make sure that our team members reflect the communities we serve. So that's an ongoing, we know and we're working on it, but we can definitely grow in that area.
This is Bev and Deborah. We have been on mute and locked in and not able to join this conversation and to join in the celebration of the incredible work at Northwell. I think that I love the way you responded to that last very important question, because I think that issues of diversity as it relates to family presence and participation are really important. And I think all of us need to work harder to hear the voices of the diverse families that we serve. And I think there are a variety of ways to connect with the Chinese community, the Latina community, the Portuguese community, the Somali community, and find out from them about what family presence and participation means to them. You may start off with focus groups, but that may be a way that you find them for, as you all at Northwell so beautifully describe, the partnership councils. But I think we need to broaden these conversations to get the policy and practice just right. Looks like we have another question from Leslie. Hello.
Yes, so Leslie asks, did you incorporate the medical practices / clinics in this work, and if so, how?
Right, so that's also part of our journey. We call them actually service lines. So we actually have included our cancer team, our hospice care team, and our speech and hearing areas as well. So part of our goal for 2020 and beyond is to go across all of our community areas and begin the formation of local partnership councils in those service lines. So although they happen in the hospital area, we are now moving forward, and that's really part of our goal going forward, to really increase that voice. We are doing a lot of work in focus group areas right now in terms of what patients and families need. We're doing a tremendous amount of work on that now, which will lead then to the development of actual councils going forward.
And to build on that answer, this is Bev. There are people that are beginning to think about these issues in skilled nursing facilities and long-term care. I think our friends in Canada have been very wise in thinking about, where we often have problems and where there are unsafe transitions of care are between the acute care hospital and skilled nursing and long-term care. And there's not been as much of a recognition of the importance of families, or again, the words care partners. And so I think that is an area that is, we need to do quite a lot of work. We've had less take up of that in recent years.
And we've actually begun working with our long-term areas as well. You know, they have some existing forums, but it's really not the same. And so we share all of this work with all of our counselors across the organization. So all of the results and everything we didn't just share with the people that had the councils. We shared with everyone because we really wanted to create that ripple effect where people were thinking, well, we could do this. Maybe done a little differently, but I'm interested. And that's really what we were hoping to do.
That's great. I think you're a visionary in that, and I think we need to really think about the continuity of the experience, and encourage that kind of broadly sharing of results.
Okay. So we do have another one. Were there any unique slash interesting technology solutions that came to light to support PFCC that you hadn't considered going into the partnership?
So our team actually does a lot. We have a whole data analytics technology team that we do different initiatives in terms of patient experience going across. For this part, you know, when we looked at in terms of patient feedback, there are certain tools that we're using to get real-time feedback and for connecting everything. We didn't actually use it for this, but we are looking forward. We are actually using technology in other ways to really enhance. One of the things we heard, especially in the medical practice area, is patients and families' biggest concern is access to when they need care, when they want the results. So we're now in the process of doing other more individualized work around that. So technology is always part of it. We didn't use it specifically embedded together, but it's tied into all of our initiatives across our patient experience domains.
One of the things we've seen broadly is patient and family advisory councils thinking about identifying patient and family advisors who are particularly interested in the technology fields. And perhaps in the future, they're going to be focused PFACs that are really paired with technology teams. I think we need to begin to move in that direction in growing the capacity to build these partnerships so that technology as it's applied really is responsive to what patients and families want.
Well, it's interesting. Right after this WebEx, I'm on a call with that. I'm actually doing a whole focus group of our practices. There's 750 practices, but we're looking in 3 areas, obstetrics, cardiology, and medicine, and we're looking at digitizing or certain technology for patients. And we put a focus group together around what is it they want, when do they want results, if they put a call in, when do they expect a call back, if they run out of medication, when do they expect that it gets filled. So we're actually starting that. A lot of the things we're doing are in tandem, but I'm actually on the digital technology piece, and that's going to be starting in a little while. Keep you posted.
Great.
Well, and Bev, I was also thinking about some of the hospitals and practices we know about where just in terms of being able to really involve patient and family advisors, they use technology so that they have e-advisors, particularly important in rural areas where, I mean, it's just not possible to come to a meeting. So there's a lot to think about and a lot to really use in terms of technology.
Okay, so in our last, 5 minutes, we have 3 more questions. Are you planning to expand your work to include your subacute facilities?
So I think we dealt with that question. Is there another one?
Oh, okay.
It's Peg Graham's question.
Actually, there's one before that. In the patient councils, are ambulatory areas distinct from inpatient or are they integrated?
So currently, they are they are not, they're separate. They have the hospital ones, and then they have their, the service line. But our culture leaders work between both areas. So there's a connection and an integration of what's happening and what patients are asking. So we really integrate that. That's what we have service lines for. So cardiology will be in the hospital, but it will also be in the ambulatory areas. And that's part of the culture leader role, is to have it integrated.
Annette, is there one more question?
Yes. So, are patient complaints systematically captured and dealt with? By that, I mean if someone is unhappy with the level of communication, for example, a diagnosis, are there any resources to resolve that unhappiness? Are patient advocates empowered to really push back?
Absolutely. We have a very in-depth process across our organization where that's handled by different teams in different hospitals, but definitely we have the whole piece about, we feel every clinician, every team member is an advocate, and we also have a whole process for complaints and grievances. We have a process for it while the patient is still in the hospital, then once they leave, it becomes a grievance. We have a whole follow-up process with quality. That's regulated.
Just to follow up on that, with the raising of the issue about a diagnosis, that they might not be happy with the diagnosis, I would urge you all to stay tuned. Really, on the newest issue that is being recognized as a patient safety issue is diagnostic error. And I think this is a very important area that we need patient and family advisors to be at the table working on that issue.
So Bev, I want to add to that, because we were part of an IHI study, and we had all our leaders, our physician leaders of quality, working on this, and we actually brought a patient partner to it. And I have to tell you, what they said is they called her a rock star, because she shared her story about diagnosis and what she felt, how they told her, and what it would have been better had they told her a different way. And you could see the whole room shift in terms of what she said. Anybody else could have said it, but because it actually happened to her, it actually changed the way they actually looked at it. So we have been partnered in certain organizations like that, and we pull our patient partners in.
Thank you so much. Thank you for all the work you all are doing. I think that Deborah has a couple of announcements, and I have a couple more to close out, but I think everybody on this call are inspired by the incredible work that you all are leading at Northwell Health. Thank you so much.
Next slide, please. And yes, Aggie and Mallory, thank you so much. We wanted to just quickly, you will have this in a handout, but to draw attention to the first link listed there will bring you to the Better Together section of IPFCC's website, where you can go through the toolkit and start using some of the same resources that Northwell was able to use. And then as part of that same section of the website, there is a featured profile of Northwell and their Better Together work. And that's the direct link to that story about Northwell. Next slide. So just to summarize, we want to leave you with these couple thoughts, that with Better Together and the work that a system like Northwell did, we're talking about family and care partner presence, not visitation. And we're talking about their true participation, not them being given permission to do something. And then lastly, although it's from 2009, it's still so powerful. Lucian Leape's quote, that families are respected as part of the care team, never visitors. in every area of the hospital, and we should say in every area of the hospital and in every setting of care.
Thank you. Next slide, please. I hope we can continue the conversation on pfcc.connect. So here are directions if you're not part of it. There are close to 2,000 people around the world. You can pitch a question about changing websites or the Better Together, or even some of the ideas expressed today by Northwell, and people will chime in and have a conversation with you. There are tools and resources on it as well. And the next slide, we hope that many of you will be joining us in Nashville, Music City. I think it's going to be great fun, as well as really important work about partnerships for quality, safety, and equity. The call for papers is out. Our call for abstracts is out. It's rather a tight timeline with the holidays, so December 4th. Please, if you don't have one, we will send the call for abstracts in the follow-up email, and please let us know if you have any questions about it. But we hope we will see many of you in Nashville in August, and next week we will be back on with a webinar talking with the New York State
Public interest.
publishing. This is a team-based work here, Public Interest Research Group. So thank you all for the work you do and your commitment to patient and family-centered practice. Thank you, Annette, for your help.
Thank you all.
Thank you.
Let's escape here.
God, I wonder what